but it's sharp. You go prick yourself and you must also prick you. Now problem they get, you don't get it.
It's Friday, and here at Burma 2 Maternal and Child Health Post MCHP in Kenema, it is Health Talk Day. On this day, nurses educate patients on best practices for safe motherhood and recommended health-seeking behavior during pregnancy. Today, Nurse Fatima Lansana is presiding. She is talking about the risk of tetanus and other dangers it poses on the unborn child.
Bottle, get them bottle so. They left they don't say they, you don't know, but it's sharp. You go prick yourself and you must also prick you. Now problem they get, you don't get tetanus. Nail, rusty nail, zinc, rusty zinc. Then even the needle the way with the
A bacterial infection. Tetanus is one of the top 4 causes of infant death, alongside fever, measles, diarrhea, according to the World Health Organization (WHO). Sections like this, 1 of 4 that take place in this space every week, targeting pregnant women and lactating mothers, provide important information to help the patient avoid risk of life-threatening infections during pregnancy. This is one of the elements of the free healthcare program introduced by the Sierra Leone government in 2010 in response to a high rate of maternal and infant mortality at the time. But over a decade since then, it continues to face challenges, which undermines the confidence of service users and impacting hospital visits. Consequently, Sierra Leone continues to rank among countries with the highest rate of maternal and infant mortality, despite recent progress in the sector. According to the Sierra Leone Demographic and Health Survey 2019, the country has of 717 per 100,000 live births, while infant mortality stands at 75 per 1,000 live births. The situation here at the Burma 2 MCHP illustrates the challenges many communities across the country face, which continue to negatively affect the impact of the free healthcare program, including inadequate water, sanitation and hygiene wash facilities, and poor working conditions for healthcare service providers. Burma is a cluster of communities located in the eastern part of Kenema city, near IDA Plainfield. The larger community is divided into sections, Burma 1, 2, 3, and 4, alongside several other nearby communities, with an estimated population of over 2,000. All these people rely on this facility for health care services. Nurse Zainab Lavali, the in charge of the Burma 2 MCHP, showed minor reporters inside the labor room just one of many inadequacies they have been dealing with on a daily basis. It has only 1 bed.
The time also have not been there. Now just like to the use of phone light or the parents then go come with light. But now we tell master thank you. We don't get the solar. The light visit no problem. But the more they live in bed, you see, it's all the iron, all done rusty. It's all done rusty. It's not enough for me. They live inside more. The instrument and the body standing scale for where the woman will not get.
Nearby, the observation room contains only 4 beds. Sometimes it is so overcrowded that they have to double the number of patients to a bed for an observation period that lasts 72 hours.
Where the woman born here inside the balloon now with the count. For 72 hours. On our 4 blade we get. If they can above that 4 or 3 or 5, I will go do, we will monitor them. Or if not, then come. We go monitor them all go there. If not two, they don't so. This school here so, this school here so. Then they don't have that because now one parents go there with them.
Out of its 5 trained staff, only 4 are on the payroll. 3 of them traditional birth attendants. Nurse Lavalley admitted that due to the recurrent shortage of medicine, they have to ask patients to buy medicine from pharmacies, and the only BP machine has been broken for a long time. For the staff, Nurse Lavalley says accommodation is a major challenge. They have to beg to use nearby private toilets of residents.
Even the toilet facility, if this mamino to Kubranaya with for disgrace. For go na yard pass will go talk to the mommy or then pass behind the house. They easy themselves.
In many other parts of Sierra Leone, maltreatment of patients and extortions are at the heart of factors hindering the free healthcare program. But here, patients say they get very good treatment. Their only concerns are the recurrent drug stock out and inadequate space to accommodate both patients and the healthcare workers. Jaminat Conte gave birth to this facility to her first child 7 months ago. She recalled her experience going through maternal care and post-delivery.
Pour le combat by this time, every self the child dey para belle, what we go dey train pass with stone. If rain dey can set with the soap, because the place small, not even know the color we go. So say we don't born back, now they are born. They be good medicine, but the medicine not enough. Now small pen and all they do with some Maria medicine.
The space business, the space not enough, water business, even water, yes, toilet business. Oh, kita pass we go, na there neighboring hostel. If you let here, you feel or go yard, pass you go na neighbor house. Other facilities that we need water, toilet, accommodation. The place not enough.
At the office of the district health management team, Francis Suma tells Manual reporters that they are aware of the constraints the free healthcare program faces, and he says they have been working on to address it, citing ongoing construction work on the new health facility nearby.
Free healthcare is a national health program, and now the government and partners always provide the requisite supplies, medical supplies, commodities for make them go use for the intended categories. When are the free healthcare categories? Now they ongoing, although yes, some shortage stock out can happen, but government can always ensure say the replenisher.
So health center that we don't visit, like the one where the Burma 2, the Burma 2 MCHP, then they cry with limited space, toilet, and even wash facility. You know, what in the DHMT they do for ensuring that they don't come to pass.
Yes, we are aware the DHMT as an institution aware say yes the health facility, the MCH post within Burma now a smaller size because thing way the current DHMT inherit where initial where the construction be done, the land space small, the building service small, and also they decided erect them just close to a big valley where other land are at the back for making any further expansion.
The new health facility is being constructed by the Kenema City Council under the local government devolved funds. The construction work started in 2022 and it was halted when the council was dissolved ahead of the 2023 general elections. Mohamed Matia, civil works engineer at the Kenema City Council, says that in their estimation, the new facility should be completed early next year. But he noted it all depends on the availability of funds.
The health center, you don't start from 2022. I budget 11 rooms budgeted health center with a CHP. So it run at we dey pay basically based on how money come na dey. We don go to like 30 to 40%. The sector itself no go finance that dey all at a go. So we dey do am bit by phases. So we dey do am phases. We finish with the foundation, we go with the superstructure, maybe we go the roofing. So na so we dey do am bit by bit until we complete am.
So when, if all goes well, when will they expect for una done?
When they expect for them to be completed early next year. Because it all depends on how government they develop the money. This is a government funded project, a grant and they use. So if the government, let's say this are the second or third quarter now. If the money wait for come from first quarter, when if we don't put the account to third quarter, then you see the gap. That's the problem. But if the money come early, as soon the money come as they develop, then we can finish out very fast.
Until the facility is completed, the authorities and residents of Burma have to figure out a way of dealing with their current challenges. As Suma explained, this is the end of the second quarter. The authorities at the Ministry of Health and Sanitation in Freetown are now preparing to deliver supply for the third quarter, but there is no indication when those supplies will arrive. Until then, these young mothers and expectant mothers will have to find the way to get the necessary medication they need.